Thank you for joining us today to talk about how you can help with the DHS Blue campaign against human trafficking. My name is Dr. Alexander Garza, and I am the Assistant Secretary for Health Affairs and Chief Medical Officer for the Department of Homeland Security. I am an emergency physician and have worked in emergency departments across the country. I started my EMS career as an EMT and paramedic and have been an EMS medical director as well.
Hi, I'm Rich Serino. I'm the Deputy Administrator of FEMA. I have 35 years of experience, most recently as the Chief of Boston EMS and the Assistant Director of the Boston Public Health Commission.
My name is Glenn Gaines. I currently serve as the Deputy U.S. Fire Administrator. I've served in the fire service for over 37 years, beginning my career as a volunteer member of the Fairfax County, Virginia Fire and Rescue Department, ending my career as the Fire Chief.
The Blue Campaign is a DHS department-wide effort to combat human trafficking. Human trafficking is a crime involving the illegal trade of human beings for the purpose of exploitation. Hundreds of thousands of men, women, and children are trafficked each year and are forced into this modern-day form of slavery. Human trafficking isn't just a problem in other countries. Cases have been reported in all 50 states. EMS professionals like you are in a unique position to encounter victims while they are being held by their trafficker, because you answer the call to help people wherever they may be, including homes and businesses. Today, we will talk about how to identify potential human trafficking victims and what you can do to help. Many of the human trafficking victims are lured from their homes with false promises of well-paying jobs, only to be forced or coerced into prostitution, domestic servitude, farm, factory, or other types of forced labor. Traffickers often take away the victim's travel and identity documents and tell victims that if they attempt to escape, the victims or their families will be harmed.
Human trafficking consists of three core elements: the action of trafficking, the means, and the purpose. These core elements can help us understand what constitutes human trafficking. Human trafficking involves an action by the trafficker. This includes the recruitment, transportation, transfer, harboring, and the receipt of a person or group of persons. Human traffickers use the means of coercion that may include the threat or use of force, deception, abduction, and the abuse of power or a position of vulnerability. The purpose of human trafficking is always exploitation, and this may include prostitution or forced labor. Victims can be undocumented workers, migrant and temporary workers on legitimate visas, or even U.S. citizens. Human trafficking can exist in any workplace. When all three elements of action, means, and purpose are present, human trafficking has occurred, even if the victim has given consent at some point or if the victim has received payment. Also, when a child is a victim of sex trafficking, it is always considered human trafficking, even if there is no threat or use of force. It is important for you to know that human trafficking is not the same as human smuggling. What sets smuggling apart from trafficking is that human smuggling involves the transportation of victims with their consent, while human trafficking involves the exploitation of victims against their will.
As first responders, we are trained to quickly assess a patient's condition in order to provide life-saving treatments. Today, we will talk about what signs you may encounter in trafficking victims. Your ability to spot these red flags could save a life. According to estimates, as many as 30% of human trafficking victims will have an encounter with healthcare professionals during the time they are being trafficked. Through your assessment, you can provide a crisis intervention that can help a victim of human trafficking.
Being aware of patients that may be victims of human trafficking is a lot like being aware of patients who might be victims of abuse from a spouse or a caregiver. Trafficking victims exhibit classic physical and behavioral symptoms that signal a problem during the examination. These include signs of physical abuse, such as bruises in various stages of healing, scars, burns, mutilations, or infections due to improper medical care, urinary difficulties, pelvic pain, pregnancy, or rectal trauma caused by working in the sex industry. Chronic back, hearing, cardiovascular, or respiratory problems as a result of forced manual labor in unsafe conditions. Poor eyesight or eye problems due to dimly lit work sites. Malnourishment or serious dental problems. Drug or alcohol abuse. Disorientation, confusion, phobias, or panic attack caused by daily mental abuse, torture, and culture shock.
Recognizing the right environmental signs will also help you to determine if a patient that you are treating is a victim of trafficking. Here are some signs to look for. Is the patient accompanied by another person who seems controlling? Does the person accompanying the patient insist on giving you information? Does the patient have trouble communicating due to a language or cultural barrier? Are the patient's identification documents, such as a passport, ID card, or driver's license, being held or controlled by someone else? Does the patient seem fearful or submissive? Does the patient appear coached in the ways in which they are responding to questions, especially related to their living or working situation? Is the patient inadequately dressed for the situation they are in or the work that they do? Are there security measures designed to keep the patient on the premise? Does the patient live in a degraded, unsuitable place? Does the patient appear to have been previously denied food, water, sleep, or medical care? If you encounter a patient who you believe may be a victim of human trafficking, it is critical that you call ICE's Human Trafficking Tip Line at 1-866-347-2423, where that information will be referred to a trained professional. Your assessment could be a lifeline to a victim of human trafficking. For more information on the Blue Campaign and how you can help fight human trafficking, visit dhs.gov/human trafficking.